This podcast is brought to you by Prolongevity, the award-winning 8-week program that can transform the lives of people with prediabetes, type 2 diabetes, and many other lifestyle-related illnesses. Founded by Phillips, the pharmacist who gave up drugs.
Hello and welcome to the latest edition of the Prolongevity podcast. I have with me today international food addiction expert Jen Unwin. Now, Jen's been on the podcast previously, and we'll talk about that a little. But today's a bit of a special because of Jen's upcoming conference. So, Jen, just introduce yourself to everyone, because obviously, world famous as you are, not everyone knows you necessarily.
I'm sure. Yes. So I'm Dr. Jen Unwin. I'm a clinical health psychologist by trade. I worked in the NHS for over 30 years as a clinical health psychologist. And then since, in quotes, retiring, I've been trying to learn everything I can about food addiction in terms of what we already know, and, then trying to advance that, trying to get it recognized as an official condition by the WHO, obviously working with lots of other people. It's not just me doing this on my own, but trying to just really get the idea out there that this condition is a real condition. It's very common, it's very serious, and we as healthcare professionals, we need to take it seriously.
I think we do, and I see a level of food addiction in pretty much every client. So I've learned a lot about the whole concept from you. Now, we've done quite a long previous podcast which talks about the principles of food addiction. It talks about Jen's book and so on. And I don't intend to replicate all of that, but please, if you're watching this and you're interested, do go back and refer to that. I can't tell you how many of my clients I sent in that direction, Jen, because it always comes up as a topic. But we'll just make this a quick fire thing, because we can find the detail elsewhere. So in general terms, what actually is food addiction?
Yeah, well, okay, I think most of us understand a little bit, even if not the sort of technicalities of what we mean by addiction. So obviously people will see it in the media, probably people have experience of it in their friends and family. Addiction to certain kinds of substances, cigarettes, caffeine, alcohol, and I think we all understand what we mean by that, which is that people have cravings for that particular substance, that they need more and more over time to get the same effect, that they start to kind of neglect other aspects of their lives, that they always lose control of the amounts. It's a very familiar thing with alcohol that people kind of say, well, I'll just have one drink tonight, and it ends up like the whole bottle. That they get withdrawal symptoms if they try and quit this substance, and that even though they know it's doing them harm, like who doesn't know that smoking cigarettes is a bad idea, they can't really struggle to quit, or they'll quit and go back. So continuing to sort of use the substance despite not really wanting to. And so we just apply all of that to sort of certain food behaviors. Obviously not any old food, not good old whole foods as nature intended, but these ultra processed foods, very sugary foods, things like the most common things when you look at the research, things like, donuts, pizza. I mean, all the things that we know, well, we might say, oh, I'm a chocoholic. It's quite a common phrase that we hear. But yes, I mean, so for some people that's literally true. It's not just a kind of, an off the cuff statement, but they have all of those serious behaviors that we associate with addiction, but around food. So cravings, needing more and more to get the same effect, starting to neglect other aspects of their lives, getting withdrawal symptoms if they try and quit, and knowing it's doing them harm. Like, so you mentioned your patients, and of course, that we know that there is a strong association with type 2 diabetes, for example, obesity. These conditions all tend to go together. And, realistically, which person with type 2 diabetes doesn't know that eating donuts is probably not the greatest idea? So it's kind of, it's not people's fault in a sense, but if we can understand that problem as an addiction problem, we have other ways to try and help people, to try and explain it to them why they're doing this behavior that they they kind of know makes no sense. Yeah. So I think if we just think of addiction broadly, and then try and think, well, does that actually apply to food behaviors? And I think we all agree that it does, even if somebody's listening and they're that mythical unicorn person who can just have one biscuit and move on with their day. You probably recognize it in other friends and family.
So it sounds remarkably like drug addiction in many, many ways.
Mm-hmm.
But I'm going to challenge you here, because does food addiction actually exist?
In the sense that do we think that those symptoms exist as a cluster and sort of in the population?
And is it recognised? Is it? I mean,
Right, okay.
we know that alcohol
yeah.
addiction, cigarette addiction, alcohol addiction are all recognised.
I see what you mean. Yeah.
So therefore,
Exist
logically, food addiction would equally be
Yeah.
Yeah.
No, sadly not. And this is what we all need to sort of talk about more, and it's why we're doing a lot of campaigning around this. And we've recently made another submission to the WHO, the World Health Organization, to get food addiction recognized as a substance use disorder in their classification of diseases, which is called the ICD. Yeah, so we know it exists because as I've described it, people will recognize it, and we know when studies are done asking people about those symptoms in relation to processed foods, about 14% of the general population screen as positive for this ultra-processed food addiction problem. So it's just as common, if not a little bit more actually, than alcohol as a substance use problem. So we know it's out there. We know it's associated with all these other health problems: obesity, type 2 diabetes, cancer, mental health difficulties. But sadly, it's currently not recognized in the health system. So if you went to your GP after listening to this and having recognized yourself in those symptoms and said, I've got a food addiction disorder, they'd say, what do you mean? And they wouldn't really know where to refer you, because if you've got an alcohol problem or a nicotine problem, they refer you to the NHS services that also help support you.
Drug and alcohol team or whatever,
they'll help to support you to get through that and to kind of quit in whatever way, in sort of evidence-based ways. But they haven't really got anywhere to refer you, apart from, if you referred to an addiction service, they wouldn't understand about food addiction and how to advise you. Some people get referred to eating disorder services, but a lot of eating disorder services are based on the premise that really it's primarily a psychological problem, and you need to be recovery looks like eating all foods fit, even ultra processed foods. The idea being that if you over restrict certain foods, that's likely to make some eating disorders like binge eating, for example, worse. So I think that's probably not true, but that's a sort of the premise. So if you went to an eating disorder service, it wouldn't be the right treatment for a person with food addiction. So you're a bit stymied really until it gets officially recognised, and then we'll have more research, more treatment, just more awareness in healthcare professionals and the general public.
So we've kind of agreed it's a thing, and it's a thing that matters to us. What's the evidence? How much evidence is there that we can come up with that says this is the evidence that food addiction exists and it is a thing that's not just inside your head and in mine?
Yeah. That we've just not got obsessed with on our own. There's a really good So I was talking about the prevalence before, how common is this problem? And for a long time, there's been a screening tool called the Yale Food Addiction Scale, which was developed by Ashley Gerhardt and colleagues. And that was based on what's called the DSM criteria for substance use disorder. So in Europe, we tend to have the WHO's criteria, the ICD criteria for diseases and so on. In America, for mental health problems, they have a manual called the DSM, and it's hosted by the American Psychiatric Association. Ashley Gerhardt took their criteria. They've got 11 criteria, but they map very well onto the 6 that I talked about. And they developed a questionnaire from that, which is extremely good, validated, reliable and so on, and has been used in thousands of studies. many languages. They've even got versions for children and adolescent now. And there was a meta-analysis of all the papers that had used the Yale food addiction scale, looking at prevalence and so on in different groups. And that's where I've quoted you the 14% from. And that was it last year or the year before? I can definitely give you that, so we can link it in the notes if people are interested to look at that study, which is sort of a sort of overarching study of all the studies that have been done with YFAS. And so there's plenty of research really, around the fact that it exists and how common it is in different groups. So obviously people study people like people with obesity, people with eating disorders, people with type 2 diabetes. There's been a lot of studies in people going for bariatric surgery, obviously, to see what the prevalence is there. Yeah, so I would say that I find all of that pretty convincing. We made a bid, in 2021, I think it was, to the WHO to have this condition recognised, and they, not surprisingly to us, we expected it really. They rejected it on a number of grounds, and since then we've been sort of trying to pursue those grounds so we can go back to them. And actually, a new submission that has been made in the last week or so. So it's gone into the WHO, and we await to hear what they say about that. One of the grounds that they had originally was that there isn't much consensus amongst the experts about this topic. So that was something that we've been pursuing since then. We did a consensus exercise with experts who are clinicians and also academics from 10 countries internationally, seeing if there could be an agreement on the nature of this thing, the causes of it, or what the treatment might be, and so on. And that's very recently been published in Frontiers in Psychiatry. And so again, I can supply the link for that, and anybody who wants some bedtime reading to get them off to sleep, they could have a read at that. But basically, 37 out of 40 experts were able to agree that there's enough evidence that this condition should be classified as a substance use disorder, which means that, it looks exactly like problems with alcohol, problems with nicotine, problems with drugs. It looks exactly like that. And those are the criteria we should use to recognise it, the ones that we talked about at the top. And, that because of that, obviously we all understand that the treatment for, say, alcohol as a substance use disorder is abstinence from alcohol. That's in the public's mind. We know that someone who's lost control of their relationship with alcohol really needs to not have any. So, it makes sense that someone who's lost control of their relationship with sugars, refined carbohydrates, and certain ultra-processed foods, whichever are their, in quotes, drug foods, then a mainstay of the treatment is going to be supporting them through to a position where they can be abstinent from those substances.
Excellent.
They can get into sort of recovery.
Yeah. So, ahead of today's conversation, you sent me a couple of slides, and I think now might be a good time to delve into those, because it covers a little bit about the research you've done and something about what's upcoming in terms of this conference. So let me just see if I can get this to work. Technology, a wonderful thing when it works. Okay. So this is towards consensus using the Delphi method.
Yeah.
And I think it kind of covers some of what we've been discussing, basically. But I don't know if you want to make any brief comments.
Okay, so we can see that, when we did the study, that the experts agreed that there was enough evidence to justify a new substance use disorder. And another thing that the WHO said to us was, well, there's all this disagreement about what to call it, which is true, actually. So you'll hear sugar addiction, food addiction, ultra-processed food addiction, carb addiction as terms that, are sort of in the space. But we were really pleased that, those 37 people could agree that the best evidence is around ultra-processed food addiction. And in a way, What's also good about that, I think, is that it sort of points the finger where the finger needs pointing. That's where the problem
Yeah.
lies, really, is with these companies putting out these kind of franken foods which are messing with people's bodies and brains, basically. Yeah.
Okay. And then your research,
Yeah.
obviously, it was a 12-month program and it was a multi-center study. Just talk us through that and what the top line of the results were.
Yeah. So another point they made, and it's completely valid actually, is that there isn't any outcome research. I mean, it's a sort of chicken and egg thing, isn't it? Where there's no money for research because it's not a recognized condition. And then they say, well, we can't recognize it as a condition because there's no outcome research. So we
Yeah.
just kind of did this off our own bats, with no funding or anything. But so here in the UK, myself and Heidi Yever, and then we had colleagues in North America and colleagues in Sweden that were running a similar program, basically based on some of the ideas we've been talking about, which is that if people, if we can help people to recognize the fact that it's an addiction, so we'd screen them using those questions and sort of talk about that. If we can explain to them what addiction is in the brain so that they understand that actually the treatment is abstinence like any other substance use disorder.
Yeah.
And then if we can support them to work out what that looks like for them, because it's very individual, but it's always sugars, refined grains and ultra processed food, abstinence from that. But then, people obviously find their own way, like they do with low carb or keto. You find the way to sort of make that fit into your own life. So we work out, what that looks like for them, and then basically supporting them to implement that in their own lives, and to what to do if, because we're all human, you have a lapse or a slip up, or how do you learn from that and move on. So the program was sort of 10 to 12 weeks, but then, as you say, we did a 12-month follow-up, because oftentimes when you see things in the literature, they're kind of saying how fantastically successful their programs have been, before and pre and post, but they never do any follow-up, so you don't actually know if it's a lasting effect.
What happened next?
It was important to do that follow-up, and we got some really, really pleasing results. So that at 12 months, for the people that completed the program and sort of stuck with the follow-up, 62% in remission from ultra processed food use disorder. We got really good significant improvements in mental well-being as well as the food addiction symptoms. We didn't publish all the stuff that we had about blood sugars and weight and so on, because it was quite patchy how people replied to that, but we did get some good results there as well. And those were beautifully maintained over 12 months. They didn't, in fact, people sort of tended to keep improving, which was also interesting. This is a lifelong condition like any addiction, and I think the longer you go trying to, live in an abstinent way, the better you're able to do that. I don't know if that sort of chimes with your experience with low carb and keto. The more years under your belt, the easier it sort of feels.
Yeah,
I think so.
It does.
And the more benefits you get physically and emotionally. So so we're super pleased with that. So both those papers are in a special issue of Frontiers in Psychiatry that I'm co-editing, which is coming to an end now, but I think we're going to have about 15 or 16 papers on various aspects of food addiction, and there's going to be a new special issue starting based on the conference, a special issue of Frontiers in Public Health, which is the other way to look at it, of course, because it's a big public health issue.
Okay, so that kind of segues nicely into the conference. So tell us a bit about the conference, who's going to be there. I do notice a certain Dr. David Unwin, who you probably know a little bit. And a lot of my mates, actually.
Yeah.
Tell us about the conference. Tell us why people should attend,
Yeah.
where it is,
Thanks.
and so on.
Super, super exciting. So we did one day conference last year to launch the consensus paper, but this year we've been a little bit more ambitious, and we've got 2 days at the Royal College of General Practitioners in London. It's right by Euston for anyone coming, into London. It is very easy to just hop off the train and into the RCGP, and it's an absolutely gorgeous venue. And I've just had the just been in discussions with the chef, actually, because, of course, most conferences you go to, you get a sandwich and a packet of crisps or something, don't you, for the catering? It was brilliant last year, and I think it'd be brilliant again, all real food, whole food catering, no seed oils, no processed grains or anything like that for the food. So the first day is focused sort of almost exclusively on the developments in the food addiction space. But then the second day, we're going to look at this issue of the comorbidities that we've already mentioned. So, how does food addiction go with diabetes, with obesity, with cancer, with mental health problems? So we've got some wonderful speakers, as you say there, the amazing Dr. Unwin, who's like yourself in practice, he says he never saw a food addict in the first 25 years, or 30 years that he worked in his practice, because he wasn't looking for them. But now he understands
Exactly.
that. He's seeing them in awe. It's just about everybody in the clinic. And I run a group for them at David's practice, and we went through the food addiction questions. So we've done it a couple of times in the group, and it's nearly always everybody in that type 2 diabetes group that recognizes themselves. So David's going to be talking about, obviously we've said, it's common, it's really common in people with type 2 diabetes and obesity, but also mental health problems. Really, there isn't a single healthcare professional anywhere that shouldn't be able to recognize food addiction and have some idea of the sort of conversation that you can have with that person. Hopefully we'll sell out of tickets, because everybody should be rushing down, so that, they can be more successful, really more sort of effective in their practice with those patients. So David will be talking about how he does that in his 10-minute primary care appointments. But we've got Trochalagen coming as well, who's recently, he's published a number of sort of outcome papers from his practice on obesity and food addiction, as a new one just come out. And he's never been to the UK. So anyone like me who's a massive fan of Trochalagen and his work and his passion as some of the rest of us, as somebody that has that lived experience of obesity and
experience,
and nearly his whole team is that way. They're all people with lived experience. So he'll be there. And we've also got David Wiss. Is a really interesting chap. He presented online at last year's conference because his wife was having a baby, so he wasn't able to come, but he's fantastically interesting and has a lot to say about sort of social justice issues and food addiction, trauma and food addiction, and also how it overlaps with eating disorders and the importance of understanding that they're two separate conditions and you may have both, but actually, there's different treatment implications. So that's another thing that healthcare professionals need to understand. We've got Mauro Brero from UNICEF, who I've never met, but Heidi has, and he's extremely passionate about what we're doing to our children and what a crisis that is. And
absolutely,
we need to very quickly be doing something different with children and families around ultra-processed food. So he'll be there with a sort of rallying cry, I think. We've got Nicole Avina and Erica Lafart, who are both world experts in sugar addiction, the effects on the brain, and food addiction. And we've got the lovely Scott Murray. I don't know if people have heard Scott. He's a really, really good speaker.
He's such a good presenter as well, Scott.
Preventative cardiologist, and he's obviously going to be talking about food addiction and cardiology, and he's got the most fantastic title, which is From Mitochondria to the Morgue. So
lovely. That's optimistic.
Yes, let's see what he's got to say. We've got Nasha Winters, that people may know from her work in cancer.
Astonishing woman, absolutely, really, and
really
lovely person. Yeah.
And she's got her own story, both in terms of the cancer, but also in terms of the role that ultra-processed food addiction was playing in the development of that, and how she works with patients around this issue, again, because ultra-processed foods have such a role in cancer. But how do we help people? How do we help people, come off those? We've got Adrian Sotomoto, who's got the brain the size of a planet, will be presenting some data, I'm sure. Karen Thompson, was an international model who's got her own story around addiction that she'll talk about, including drug addiction. But she's run residential programs for people with food addiction. So she's going to be telling us about that. We've got Kim Dennis, who's an expert on eating disorders and food addiction and runs a residential program. And Simon Dankel, who's also going to be talking about cancer. He's done a lot of work on ultra-processed foods and cancer. That's all sort of the day two people. It's always lovely to sort of meet people in person. So, I'd encourage healthcare professionals to come, but also, obviously, anyone who's listening who recognises themselves in this, the general public are really welcome.
That's pretty much all of us then.
That's everybody, really. Yeah, and we've got Molly and Clarissa, who are co-hosts of the Food Junkies podcast, which I commend extremely highly to anyone who wants to know more. They've interviewed with Vera Tarman just about every expert in the world on food addiction, so you can go back and listen through the back catalogue. But they're going to be hosting the panel debates and
fantastic,
keeping us on tracks. So that'll be good. So I think it'll be a really nice meet up for anybody who recognises themselves in this as well. Lots of exhibitors as well coming along.
Fantastic. So I think we'll wrap it there. We haven't tried to go into the weeds of all this, but I think we've covered sufficient. Anything to add, Jen, that we've missed?
I think that's covered it, hasn't it? Yeah, I think so.
I think so. Good. Okay, well, only remains for me to say that Karen and I will see you at the conference, if not before, and I very much look forward to it. And thanks for your time.
Thanks very much, Graham. See you there.
See you there. Bye now.
If you enjoyed the podcast and want to find out more, join our Wellness and Prolongevity Facebook group. Don't forget to subscribe and follow so you never miss an episode, and maybe share to friends and family who might benefit. Finally, if you think you might need help with diabetes, heart disease, or any of the other diseases we discuss, then book a free consultation with Graham. There's absolutely no charge for this, and we would never put you under any pressure. What do you have to lose? Bye for now, and see you for the next episode.